Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we are taking your calls right here, right now at 866-870-5752, right here in the studio, 866-870-5752. You get a free book when you call the show. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate, with 264 scientific studies. The foreword is written by the late Suzanne Summers. And Dr. Darrow, she has you in her book, A New Way to Age. You had like a whole chapter in there or something.
Yeah, she's done interviews on me in a few of her books over the years. And Suzanne Summers was literally one of my best friends in my life. I adore her, and she will live on forever. She has helped so many people stay away from things in traditional medicine that are not good for us. And I use the word traditional or alternative, but in truth, traditional medicine, the medicine of today, to me, the high-tech form is very dangerous. It is needed in many cases. If you're dying, go to the hospital, you'll get that. But if you're a person that's just having some issues, please think of other alternatives. To me, traditional medicine is alternative, and that's what we call these terminology things.
Oh, sorry.
I know, we got Betty still hanging there. Betty, I'm with you, don't worry. Dr. Marc Darrow is with you. But I got some stuff to say first, so please hang with me. And also, I don't really mention this often, but Dr. Dre, the rapper, wrote, and Nita, I don't know if you've looked at the back of the book ever, but he wrote a very nice recommendation for me.
Yeah, I saw it.
Yeah, he's an amazing person, and he's really one of the nicest guys I've ever met in my life, very respectful, and very healthy guy, takes care of himself very well, works out every day, and I'm going to shout out to Dr. Dre. I love you, Dr. Dre. You're a great, great person. And, celebrities get a lot of bad rap, a lot of good rap, and this guy gets a lot of good rap. Get it, Nita?
Yep.
Then you're not laughing.
I'm listening.
All right. So before I get back to Betty, I want to mention a couple other things that we do beside healing people's orthopedic pain, the joints, the tendons, the ligaments, everywhere from the back of the head down to the bottom of the feet, and neck pain, back pain, joint pain, shoulders, elbows, wrists, fingers, arthritis. We get tons and tons. I think the things we see the most of are knees and then shoulders and then low backs. But we do everything on the body, anything that is causing pain. And we use an ultrasound so we can find little muscle tears. We had an Achilles tendon problem yesterday, and we saw this little teeny minor tear there that you can't really see with an MRI. A lot of times MRIs do not give us the information we want, and don't rely on your doctor saying, well, your MRI showed this or that, because that may not be the pain generator. We need to find where the pain is using our fingers, using our hands, moving the person around. Then we use the ultrasound, which is live right there, to find out what we can see and go to that area. MRIs are often overly sensitive. They will show things that do not really exist. A lot of people come in after an MRI and they say, I've got an ACL tear. That's the anterior cruciate ligament in the knee. And then we look with an ultrasound, or a surgeon goes in to fix it, and they go, that's weird, it's there. New study that came out showing that, I haven't read it yet, but I was just told about it, 98% of ACL ruptures heal on their own without surgery. And oftentimes, by the way, that surgery is no fun and the recovery is no fun. Don't do it if you can help it. A lot of times if your knee is banged up and they say you've got an ACL rupture, that's not the problem. The knee just got banged up. And what I do with those patients, as soon as they come in, there could be a little tear in the ACL, a little teeny one or a major one. I just use the ultrasound. We aspirate the blood out so it can heal up quick, and then do some stem cells on it and get it healed up. I've had some world-class surfers who've come in with ACL ruptures, gotten them back on those waves, and that's one of the most ballistic sports on the knee that there is, dropping in, on a 20-foot wave. It's actually like falling 20 feet and hitting, that turn. So be careful. Don't get a surgery you don't need. So Betty, do you have anything else you want to tell us?
Just I have osteoarthritis.
Okay, well, I'm not worried about that.
To the left knee 20 years ago.
Okay.
And I'm not a candidate for surgery, and I really want to get PRP or stem cells.
Okay.
Which one that you would say?
Okay. Well, you'll make the decision. I'll give you all the information.
I have talked to you before, and this is a workman comp case.
Okay.
And I was seeing this gal that's been doing it like 4 years, 5 years.
Yep.
And she wants me to be off the blood thinner for a week before and a week after, so I will have good plasma.
Okay. Well, you don't need to do that. And you have good plasma. You have good blood. So I'm not worried about that.
Just doing that so I can keep coming in, and she's not doing any treatment.
Well, that's fine. That's not the way I do it. Everybody's got their own way of healing, and God bless her and God bless all the healers on the planet. I do what I do based on over 25 years of experience, and it seems to work pretty darn good. Betty, if you want to get a lot of information, go to Yelp, YELP.com, and put my name in, Marc Darrow, MD, and you'll see, I think there's a few hundred reviews there that are pretty cool. There's some bad ones too. You should read those. And the funny thing about Yelp, it's not really funny, is as a doctor, I can't respond and even say that I know the patient.
Okay.
Because that's a HIPAA violation.
Yelp.com.
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 Look up Marc, M-A-R-C, Darrow, D-A-R-R-O-W, M-D, and you'll see what people have to say about me. The good, bad, and the ugly.
Okay.
Be wary. There are a lot of people who like to write bad stuff because they like to write bad stuff. There's a lot of disgruntled people on this planet, and I am not able to reply with the truth from my side.
Okay. Yep. Oh, okay.
All right, Betty. God bless you. I appreciate it, and looking forward to seeing you.
Thank you, Betty.
I'm looking forward to seeing you too.
I just want to mention, Nita, that Larry Marino, who is, works with KRLA,
yes,
gave out the phone number and all to give a care package to our troops.
Yes.
And it's something I did, and it makes me feel so good. I'm going to do it again today after the show, and I think it's something everybody should do. Our troops are. I was in the Army back in '69, and luckily I didn't go to war, but it's lonely there, even not being in a war. So every day I was there, I was lonely. I was homesick, and I wish someone had sent me a care package. So these guys need it. Give them as much as you can. Right, Larry Marino?
It's a great idea.
Larry Marino is a great guy. I've been working with him for years. All right, so give out the phone number again and the website. Write this stuff down. So to call us right now live, like Betty just did, the phone number to talk to me is 866-870-5752. 866-870-5752. And if you want to call the office and get a free consult on the phone with my staff, that's 800-300-9300. 800-300-9300. To watch me doing videos, watch videos of me doing these procedures all over the body. And Dr. Grove, our new injector, He's not new to the field, but he's only been working with me for several months. He is a prince. He is one of the greatest people I've ever met in my life. I adore him. I love the work he does. I love how much he loves the patients just like I do. And he is a healer. I tell all my patients that he has the hands of God, and he gets amazing results. You can watch videos of him also on the website. Go to www.jointrehab.com. You will learn more about regenerative medicine, about platelets, about stem cells on my website than you will any other place that I've ever seen on the planet. And our stuff is real. It's not this made-up stuff about miraculous things happening. We don't have testimonials on there, which is really considered false advertising. And be careful. If you have someone who's got testimonials on the website, what about the people it didn't work on? Where are their testimonials? It doesn't work for everybody. I'm just being honest. There's reasons it doesn't work, and it's usually because of the patients. Most people who listen to me heal. So there are reasons for failure. Too much activity, taking ibuprofen or other anti-inflammatories, not getting enough treatment, not using an ultrasound to guide the needle, or just getting a doctor or nurse doing it who is not really qualified. And it's a shame. People are abusing the name regenerative medicine. It's given us a bad name generally. And to be honest, I don't know a whole lot of docs who do this very well. I don't know guys who do it all day long. There's a few of us. We do it all day long, every day of the week. And take a look at Yelp.com. Look up MarcDarrow.com. See what people have to say about this stuff. Don't listen to me. All right, Nita.
Yes.
Should I challenge you with a joke, or should I go to
Oh,
questions?
maybe it's time for a question.
Okay, here's the question. What kind of lights did Noah want to put on the ark?
Oh, I thought we were going to another type of question.
I know you did,
like
Nita. Put on your thinking cap. What kind of lights did Noah want to put on the ark?
flashing lights.
Oh, you're so close. Floodlights.
Oh.
I'm going to give you 50% on that
Okay,
one.
that's very generous of you.
Here's a good one I know you'll get. Why was the blonde staring at the carton of orange juice?
Okay, I don't know if I heard this correctly. Why was the blonde staring at a carton of orange juice? Is that what you said?
Yeah, I did. Because it read concentrate on the side.
You just insulted all blondes, but it is pretty funny.
I know. Can we even do blonde jokes anymore? It's an age
Not
of
really.
being
It's not
offended.
really politically correct, I don't
No,
think.
probably not. I apologize to everybody.
That's okay. You could go to an orthopedic question. That's what I thought you were going to do.
I know you thought. Everybody thinks. One more, Nita.
Go for it.
See if you can redeem yourself. So the first half of this I know you're going to get, but the second half I don't think you will. You ready?
Ready.
If you get the first half, I'll give you a point. What's black and white and red all over?
A newspaper.
Good. You get a point. And what's the second answer?
Same question?
Yeah. What's black and white and red all over? This is hard. A blushing zebra.
Oh, my gosh.
It could happen, right?
It could happen.
All right, I'm going to give you one more chance. What do you get when you cross a centipede with a parrot?
A parrot with a lot of legs?
Well, that's true, but that's not funny. A walkie-talkie.
Okay, we're moving on now.
What do you get when you cross a centipede with a parrot? A walkie-talkie.
Okay.
All right, Nita. You're not laughing hard enough.
Okay.
I'll have to laugh for you. It's so funny because when I'm with my family and I do my dad jokes, nobody laughs except me. All right,
Well, at
here's
least
one
you're
that says-
enjoying yourself, so that counts, right?
I do. And my brother-in-law, God rest his soul, died a year ago, Bob Babin. He told jokes nonstop. Nobody laughed, but he laughed, and his whole body would shake from laughing, so we would laugh at him laughing, but not his jokes.
That's
He
funny.
was the guy that would tell these long jokes where you just wanted them to shut up. At least mine are one-liners. All right, so here's a question. Herniated disc and knee arthritis. Do you have treatments for herniated spinal disc and knee arthritis? Probably, yeah. Regenerative medicine. How do we do it? Well, first of all, most herniated discs do not cause a problem. How do I know? Because I get people who come in all the time. They have an MRI that shows a herniated disc, but when I examine them, it's not the disc that is causing the problem. They're not necessarily having any pain down their legs or down their arms, which is a sign potentially of a herniated disc. They're just having localized neck or back pain. What is that usually? Believe it or not, most neck and back and spine pain is from sprains. What's a sprain? The tissue has been disrupted from a fall, from lifting, from things like that. And then unfortunately, too many people who come up with an MRI that shows something get a surgery that they didn't need it for. What's my job? Keep people from getting surgeries they don't need. So what do? We use platelets and/or stem cells around the area that's causing the issue, stabilize the vertebrae, and get the pain gone. Knee arthritis, same thing. We do it all day long and with great results. So yes, we can help both of these things. If you have something called degenerative disc disease, generally that does not cause pain. Do not get a surgery for that. It's not the real diagnosis. Unfortunately, most people who come to me after being diagnosed by another doctor have the wrong diagnosis. Why? Doctors use images to diagnose. Is that a good idea? I don't think so. If it's cancer, sure, but not for musculoskeletal pain. Nita, anything to tell me here before I go to the next question?
No, this is great information.
Okay.
I'm sure
so this
the
one
audience is loving this.
81-year-old back pain question, too old. Let me see here. Okay, so this person's very organized. They have 1, 2, 3, 4, 5. Chronic back pain due to overstretch in martial arts taekwondo. Okay, we take care of those every day of the week. A lot of martial artists. We just had 2 of them come in yesterday. Pain comes when bending back, walking too long, or sitting too long. Okay, we take care of that all the time. Weakened back muscle. I don't know what they're saying here. Let not hold me from falling backward. I'm not sure what that means. Weakened back muscles, not really a problem with pain. Most people who are walking around do not have weak back muscles. They may be told that by somebody, but that's not usually the diagnosis in real. It's not where the pain is coming from. Which insurance cover the stem cell therapy? If you want to talk about insurance, we don't do it on the show. We don't talk about money. You can call the office and get a free phone consult with my staff. They'll talk all about those issues with you. And if you want to call the office, there's people there now. 800-300-9300. That's 800-300-9300 at the office. And then a question, too old, question mark, 81 years old. No way. We treat, I had a lady in a couple of days ago. She was 97, had treatment on both of her knees. She was in a wheelchair, couldn't get up. No big deal. She had good mobility in her knees. I looked with an ultrasound with Dr. Grove, and we saw some fluid on the knee. We took that out and then injected her with stem cells. I think she's going to do real well. We'll find out in a couple weeks. We have most patients come back in a couple weeks. Phone number to the studio right now. Call us live. 866-870-5752.
If anyone is interested.
Somebody's talking over us, aren't they, Anita?
I do have this.
It's gone.
Navy dress.
It's gone. Sorry.
Not gone to me. Anyway, phone number.
20.5.
Alex, get rid of that, please. 866-870-5752. Thank you, guys. That's live to the studio. We would love to talk to you. Lipoma removed bulge disc. Okay, another question here. So I've been having lower back pain and feel rather confident the root cause is connected to removal of a large encapsulated lipoma. And by the way, if you want to look up these words like lipoma, it's Lipoma, go to Google, put it in there, type it in, and then on the upper left-hand corner where the menu button has images, click on that. You'll see what it looks like. Encapsulated lipoma on my right side below my adrenal gland. It began to bother my back in 2022, and through two MRIs, it was identified I had a bulged disc and disc degeneration at S1, L5. I can't seem to resolve the pain completely. I want to see if stem cells might be a resolution, or see what Dr. Darrow or Dr. Grove has to say, as traditional Western medicine providers have been unhelpful in addressing the root cause. Good, smart person. The recommendation is muscle relaxers. Don't do that. That just covers the problem. And muscle relaxers can make you dizzy. Definitely don't take it during the day, especially if you're driving a car or walking down stairs or something. You can kill yourself. Injections that they've offered me, such as steroids, cortisone, I am not aligned with in my healing philosophy. Smart person. My father referred me to Dr. Darrow, thinking he may have some alternative ways to heal my back. I do, and get me moving my body properly. The grief around movement has been really challenging. I'm so sorry. I understand. I've been there, and thank God I've healed my neck and back, and my knees and my shoulders, my elbows, my wrist, with regenerative medicine, platelets, and stem cells, and I think this is a good candidate. I think you should come in. The number to the office is 800-300-9300. We're going to contact you and send you a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. We're going to pay the postage, and you can read about these kind of things. So what does a lipoma mean? It's a piece of fat. And typically there's no reason to remove it except for a couple reasons. One, it can encroach on a nerve, but typically doesn't. Sometimes people have it removed for cosmesis, meaning they don't like the way it looks. Some people have them all over their body, and it's not a big deal. So this was removed, but didn't help. And while they were looking at it on ultrasound, they happened to identify a bulging disc, big deal, means nothing. And disc degeneration, big deal, means nothing. We're going to the end of the show. Call my office, 800-300-9300, or go to the website, www.jointrehab.com. God bless you all. God bless you, Anita, Suzette, Alex, and the rest of the crew.
And Steve.
We love you very much. And Steve, thank you.
Awesome. See you next time.
You've been listening to Living Pain Free with Dr. Marc Darrow. And now that you've heard Dr. Darrow, call his office at 800-300-9300 and speak to one of his joint rehab experts for free, and ask for a copy of his book, Stem Cell and Platelet Therapy. Schedule an appointment by calling 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain Free with Dr. Marc Darrow is heard Saturdays at 10 a.m., 1 p.m., and 5 p.m. here on AM 870, The Answer. Take the first step toward a pain-free life. Call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.